It's described as an essential aspect of everyone's health. Mental stability helps us all cope with stress and affects our decision-making ability and skills to build healthy relationships and community interactions. What the UN describes as a state of mental well-being is crucial for our socio-economic development and in our communities too. Despite an increasing acknowledgement of the critical role that mental health plays in our lives, sufferers of mental health conditions are often stigmatized and discriminated against. The World Health Organization's mental health report reveals that around 1 in every 8 people have a mental disorder. 85% of people with mental disorders in low and middle income countries receive no treatment at all. For more than 25 years, Devora Kestel has been one of the loudest voices in the field, implementing and advising governments on policies related to mental health systems. She leads mental health and substance abuse efforts at the World Health Organization. So, what are the consequences of inadequate mental health policies, and what improvements are possible? Devora Kestel talks to Al Jazeera. Devora Kestel, welcome to Al Jazeera. We seem to hear so much more these days about mental health, particularly since the pandemic. Does that mean that more people are dealing with mental health issues, or that we're just better now at talking about it?
The answer to your question is both, perhaps. The number of people suffering from some mental health conditions went up as an immediate consequence of the pandemic, and then we are still seeing that increase. But on the other hand, perhaps because it became more common, many more people have been talking about that, and therefore we hear more about mental health. So both.
In last year's World Mental Health Report, the World Health Organization talked about the issue of stigma that surrounds mental health. How pervasive is stigma, and what needs to be done about it?
Thank you for quoting the report we launched indeed last year. What we know about stigma is that people with mental health conditions are still seen as those that might end up being discriminated. There is a lot of prejudice. There is a lot of thinking that if you cannot get out of bed because of depression, the first reaction is that you may be lazy, that you may not have enough willpower or energy to move on. So it's not considered as a condition that is affecting you in the same way that it could be any other physical condition. And this is valid for any mental health disorder or condition. Traditionally, we have sent people away to recover, to spend years in institutions locked away from the community, from the society, and all that has contributed then to stigmatize the people with mental health conditions, like something that you can't see, that is dangerous, that is unexpected reactions to be produced, etc. So what can be done in order to overcome that? Well, recently there has been, last year actually, the Lancet Commission did a study on stigma and discrimination related to mental health. And the most important action is the social contact. So bring people to the community where they belong to, and you work with them in that community, and that fights a number of misconceptions and makes a general public understand that anyone can have a mental health condition and is just one more of us among us. If you think that mental health conditions are affecting the population massively, 1 in 8, around 1 billion people affected by mental health disorders, that means that is any one of us. We all know someone, we all have had a moment or a more serious issue. So that is what, by bringing people together to the community, is what we are promoting, that people are not isolated, and that then we can overcome that stigma.
We talked
Allow
about...
me to say something else.
Yes,
yeah,
please do.
Sorry. No, I mean, the people with severe mental health conditions then die earlier than people without those conditions, simply because their physical health conditions might be ignored because of the same stigma in many cases. You see only the mental health and you ignore the physical component, and vice versa then.
We talked, Devora, about the pandemic. Many people will perhaps have experienced mental health issues for the very first time during the pandemic. The World Health Organization described its impact on people and mental health services as devastating. Before the pandemic, countries were spending, what, less than 2% of their national health budget on mental health, and were already struggling to meet demand. Are things getting any better now?
This is a difficult question to answer right now, because my answer would be, I don't know. We are going next year with a collection, a survey that we do every 2-3 years to countries to measure, to get information in many issues related to mental health. Among those are the percentage that countries spend on mental health from the health budget. We don't know that. What we know is that during the first year and beyond of the pandemic, the mental health, mental, neurological, and substance use related services were reduced as a consequence of the pandemic. Many countries empty mental health services from mental health people or patients with mental health issues, and dedicated those facilities to isolate people with COVID, which could have been understandable, of course, at the time, but then those services were not given back necessarily to the mental health practice that they host before. So some countries might have increased the budget. I'm not sure will be.
Let me ask you this may be equally difficult to answer, but is any country in the world at the moment getting it right in terms of mental health services and funding?
Well, you know that this is also, as you said, difficult to answer because of the variety among countries, but some high-income countries are allocating around 10, 12, 14% of the governmental health budget to mental health. Many middle-income countries could be around the 5%, for example, but we don't have a standard indication here, because a country could allocate 10% and still do bad with the services they offer to the population. But definitely requires some increase. You can't answer to an increased need with the services that you set up back in the day when none of this was known and none of these issues were conceived as a problem that will affect everyone.
You talked earlier about the pandemic, or since the pandemic, more people have been experiencing mental health issues, and we're getting better about talking about it. But I wonder if you can speculate upon why so many people all over the world, no matter what their socioeconomic circumstances, are experiencing issues with their mental health. Is there something about the way that we live now that's driving this, or are people suffering as they always have, but at least now they're getting the help for it so that we know about them, they're not suffering in silence?
Well, you know that during the pandemic there were also some consequences in order to reframe the situation that we were living in isolation. Many people lost their job, the education at home. So a number of the women taking care of children, and in the meantime having maybe maintaining their job distance, and a number of factors that contributed to increase those conditions, right? So that was during the pandemic, during the period of pandemic. But then we have known from before that socioeconomic challenges have, as a consequence, an increase in mental health conditions. We have evidence from many emergency contexts, humanitarian situations, where we see an increase in the number of people with mental health conditions, and the pandemic was just a massive humanitarian situation, right? And so the consequences are still there, because still people lost their jobs, still the economic situation is difficult, many inflation in many countries, etc., and that generates anxiety, depression, and a number of other conditions, or could generate. Now, it is also true that we speak more about, and then issues that before have no name now can be named.
Okay.
Now we can understand that what is happening is related to a known mental health conditions such as depression or anxiety that are the most common ones. So once again, both issues.
Devora, suicide rates among men remain alarmingly high. I mean, depending on the source of the statistics, it's around 75 to 80% of all deaths by suicide are among men. Why is that? Does it mean that men are suffering more with their mental health than women? And if not, why the disparity in suicide figures?
Well, one of the explanations is that men, the suicide attempts the numbers are higher among women. And the reason, then the explanation is that men use more drastic methods when trying to end their lives. So they do it at the first attempt in many cases. So that could show the difference.
What can be done then about this? Do men need better role models and advocates for mental health? Is it a societal problem? Is it something that governments and health agencies need to be attempting to fix?
Well, I would say that for suicide prevention, the best control is controlling the means, making sure that there is enough understanding by the health professionals of what could be a person going through and what needs to be done in order to prevent that, to move on and end up in a suicide or suicide attempt. There is a role for journalism that need to play a better role in offering messages and communication around suicide. Those would be some of the issues that are specifically related to suicide prevention. But then, of course, men need to be probably in some cultures more than in others, addressed in order to make sure that they speak up about the challenges they are facing. Again, particularly in situations like the one we are having now, when the economic pressure might be very high, the man traditionally holds responsibility in many cultures, and that needs to be then understood and then provided an environment where the man can talk about the challenges and what needs to be done in order to prevent getting to the extreme of, I can't do it anymore and I need to end this.
You talked about people experiencing social isolation during the pandemic and loneliness, but even before the pandemic, 60% of Americans said that they'd experienced loneliness. What does loneliness and social isolation have? What impact does it have on mental health? And what should we be doing to try and fix that?
We have known for many years that, for example, loneliness and suicide in isolated rural areas was one known factor. That's related to a question you asked before. I didn't answer, and it is our lifestyle is changing, and then more attention should be paid, particularly to younger generations, on how we communicate, how we avoid the isolation that sometimes can be promoted because of these modalities that we have nowadays of communicating through the media, right? And then avoiding the direct contact. That's part of the education that needs to be perhaps provided in schools for younger generations on how to take care of our own well-being. And
you think that needs to be done through education then, and not via legislation on the social media companies?
Well, maybe the social media should play a role as well in promoting, exchanging, in alerting about the need to avoid that isolation. But I think it is an education that we all need to be aware of, and that needs to be done in family context, in schools, in places where the younger generation spend still most of their time, and then social media could accompany also those efforts as well. Yeah.
Mental health services in the developed world are improving. Many people, regardless of their socioeconomic circumstances, do at least have access to decent mental health support. What about people, though, in the developing world? How do people who live in abject poverty, where access even to basic healthcare is limited, how do they deal with mental health issues?
Well, there are many strategies that need to be put in place, and we have been advocating some of them. The most known one is what is called task sharing or task shifting, right? To enable health personnel from the primary care level to understand, to learn what needs to be done in order to detect and to manage and treat people with mental health conditions, in a way reinforcing and re-educating many health workers on mental, neurological and substance use issues, because the traditional training of medicine does not necessarily cover that field perhaps properly in many low and middle income countries. So that's one, so that we make sure that the primary care, the first access, level of access to care, has already knowledge and capacity to manage those people, the challenges that people with mental health conditions present. But then there are a number of issues and tools, practical ones, that are including using social media or the IT and digital technology, that are self-help. There are very useful tools that could help you learning basic exercise that can help you manage stress or some other related issues that anyone could encounter at any time. There are also tools to train lay people, right? People from the community without any specialized health training to use some form of listening and advising people with some common conditions, and etc. I can't list them all, but the strategy is we don't need to wait for the highly trained, specialized professional to deal with every single problem. We need to go down to the community at every level, and the health sector and beyond every level, school, social, prison, labor market, etc., to enable those who are there to do proper interventions, to know what needs to be done, when to be done, and then to refer to the most to the higher level of in the category, to those few people that have done all the training that is needed to take care of the more serious and complex cases. That will be the strategy to deal with a phenomenon that is broader than what we want to accept in the first time.
Devora, to what extent does substance abuse go hand in hand with poor mental health?
Well, to a big extent, or to a large extent, there is a lot of comorbidity between mental health and substance use. And we talked earlier about stigma on mental health. Well, on substance use, I think it is even worse. For both alcohol and drugs and other addictions, it's hardly seen as a health problem, as a health issue. Is mostly blaming the people who abuse or use in excess those substances. And so also there are a number of interventions that could be done at the primary care level with brief interventions and trying to intervene as soon as possible. Then there are policies that need to be in place. The field of alcohol is more clear, policies in terms of availability, limiting availability, etc., and other policies that are proven to be effective to contain also the challenge.
Devora, is the decriminalization of cannabis in some parts of the world, in many parts of the world, a positive or a negative step, do you think, in terms of mental health?
Well, as in many other areas, it's hard to come up with an answer that is one or the other, right? What we are issuing now, hopefully very soon, an updated report on the health and social impact of cannabis consumption. And what we are learning from some countries is that it depends on what form of public health measures the country has put in place in order to ensure that the health of people are protected, whether the cannabis access is legal or not, and how that health is protected, with particularly emphasis on youth, because the impact on an adolescent is going to be different than the impact that cannabis consumption could have in an adult. So public health measures is what is needed to accompany these decisions.
That brings me to my next question. There's evidence that young people appear to be shunning alcohol and tobacco in greater numbers, which is good, but their appetite for so-called recreational drugs and nicotine delivery systems, I'm talking about vaping rather than smoking, hasn't diminished. How concerned are you about that? In terms of their use of recreational drugs, to what extent are they storing up mental health problems for the future?
We are talking about young people that need to know and need to learn how to cope with stress, how to cope with the challenges at school or in any environment, and how to cope with the emotions in general, rather than going and looking for any other substance that is external to that emotion that may be seen as a solution or as an alternative to the challenge itself.
Okay, let's talk about the opioid epidemic in the US for a moment and elsewhere. How concerned are you about that? What can be done? What needs to be done to stop people dying in the numbers that they are right now?
What we believe is that the risk that this expands to other countries, the situation with opioids or other synthetic drugs, is being monitored, is being seen, and there are policies to combat that epidemic that are being introduced.
Australia has become the first country in the world to legalize the use of psychedelics to treat some forms of depression. Reports suggest that they're extremely effective at helping long-term sufferers of depression and post-traumatic stress. Do you think that's a good move? Is regulating psychedelics, specifically psilocybin and MDMA, the way forward here? Are you personally excited by their potential uses in mental health?
There are a few other countries that are working in that same area. We have been in touch with colleagues now and then about that. We are looking forward with interest, of course, if there are more studies coming up proving that the treatment is effective and in the conditions that are needed. We will follow up definitely with interest, and hopefully, why not? Any option that serves the purpose of alleviating the sufferance of people with mental health conditions is welcome. There are a few countries working on that right now. I could quote some countries here in Switzerland, the US, and others probably in Europe as well. So looking forward to learn more about that, yeah.
Getting back to what we talked about right back at the beginning of the interview, when we touched upon the fact that more people than ever these days are experiencing mental health issues because of the way in which we live today. Are you confident that we can nip this growing problem in the bud here, or is this going to be a problem that unfortunately is set to grow, that more and more of us will experience mental health issues?
I think that we have always experienced mental health conditions, and we will always continue to experience them. Hopefully, the length of the suffering could be shortened. Hopefully, people would not need to suffer in silence. Hopefully, people will receive the treatment that they need, no matter where they live. And that's what should change, right? The access to services that you mentioned before, and the new treatments, options that could come and would be easier to manage.
As a mental health advocate, you've been doing this a long time. Are you more positive now than you have been in the past about the way things are looking?
I am. It's still a long way to go. For the time being, I hear more talking. And you asked me earlier about the budget, and I couldn't answer. Hopefully next year, when we will have the results of the budget, you will call me again, and I will be able to tell you how much we increased with the budget allocated to mental health globally. Right now, we don't know that part, how much we are doing better, but definitely the talking is leading us somewhere. Into more awareness, into more understanding, into looking for more options and solutions. So I am optimistic, definitely.
Devora Kestel, thank you for talking to Al Jazeera.
Thank you for this opportunity.